Happy Women's Day, everyone. My name is Dr. Taranum. I have finished my MBBS from Deccan College of Medical Sciences, and I have done my MS Orthopedics from Nizam's Institute of Medical Sciences. I have also finished my DNB Orthopedics, and I have done my fellowship from Dr. Sandeep Patwardhan. I have done my Pediatric Orthopedics Fellowship. With over 5 years of experience, I have done 100 plus surgeries. Coming to my post-graduation days, when I joined my post-graduation in NIMS, I was an expecting mother along with a first-year resident. So it was quite a challenge for me being pregnant and then joining to a department which did not have many women back then, and it was a male-dominated department. But my passion has driven me towards becoming a better person and showing the dedication and compassion towards my towards my passion to become a good female orthopedic surgeon. And this would not have been possible without unconditional support from my family and my husband, Dr. Salman Sadiq. My post-graduation days, I was topper of my batch and my university, Nizam's Institute of Medical Sciences. So one of my achievement was I have done a lateral ankle reconstruction. The procedure is known as modified Trisman-Snook procedure last year. The patient came to me with instability in the ankle and giving away sensation. We had an excellent result post-operatively. I have a follow-up of 18 months of that patient, and for that my work, I recently got Best Poster Award in the recently conducted Telangana Orthopedic State Conference. I have presented multiple papers in national and state conferences. I also got Best Poster Award in Telangana State Orthopedic Conference in 2023 for my work on we have done a case report on diffuse Burkitt cell lymphoma causing periprosthetic fracture in total knee arthroplasty. Reciprocate to him, the level of respect they used to give. So I had that thing that I also want this in my life. I also want to be like him. I also want to treat the patients. I also want to be exactly like him. So that passion has driven me in taking an MBBS and becoming a doctor. Further, when I did my MBBS, when I joined my internship in Deccan Medical College, my first posting was orthopedics. So it was very fascinating for me seeing the broken bones getting fixed, and the patient who came in utmost pain, he could go back nicely, happy, painless, few walking, few taking precautions, but used to walk eventually in few months when the fracture got united. That thing was so exciting that I wanted to do that. Knowing that it is a challenge, knowing that it is very physically exhausting, knowing that this branch is male dominated, still I choose to take that branch as a challenge, and I thought when everybody is doing, why I cannot do it. So this passion and this zid, this drove me in becoming an orthopedic surgeon. I would not say that I'm a female orthopedic surgeon. I would say that I'm an orthopedic surgeon. What my mentor taught me was there are no male and females in surgical branch. There is only a surgeon. So I am considering myself as a surgeon who wants to do better to the society, who wants to take care of the people and give them a painless and happy environment.
Other doctors, or you feel women patients are more comfortable when they come to you?
Definitely, I feel this point that as a woman, I also may not be comfortable in going and getting myself examined near a male surgeon or a male physician. Definitely, women doctors have a superiority when it comes to coordinating with the fellow women patients. And in my branch, lot of women, though they will be in lot of pain they will be tolerating pain for a longer duration, they will be very shy to come to a male surgeon or a male orthopedic surgeon to come and tell their complaints, like they have pain in their hip, or they have a pain in the lower back, or suppose we have to examine their knees. So a lot of women in our country, they are very shy going to a male and letting the male surgeon examine. But definitely I have a advantage when they come to me, because they have that level of ease when they come to me. They will be very comfortable if I touch their knees, if I examine their knees, if I examine their hips, if I examine their back, and if I examine their shoulder. So this level of comfort they will feel with me, and they can share their complaints in a much better and relaxed way. So I feel this is the advantage of being a female orthopedic surgeon. So I think the whole point here was making our woman comfortable coming to a fellow woman who is also a doctor, an orthopedic surgeon, and sharing their problems with much ease and getting the treatment and being content about it. Yeah, definitely. A lot of women who will feel twice before coming and addressing their problems to a male orthopedic doctor, because they are very shy to share their problems and they are very shy to let the doctor touch them or examine them. So I think if you have females in this branch, that is definitely an advantage to our general women population. I have presented a case report done in my institute where I was doing my post-graduation. Back in 2023, I got a Best Poster Award in TOSACON 2023. The case report, I will give you a brief details about the case report. Basically, we have diagnosed a very rare kind of Burkitt cell lymphoma, a diffuse Burkitt cell lymphoma. It is a kind of blood cancer which is usually not seen in a bone pathologies. So we have diagnosed that in a total knee replacement patient who has come to us 2 years after the surgery, and she just had a very simple fall. To give credit to Dr. Sandeep Reddy, he was my professor in my PG institute. What I learned from him was how to be humble, how to be polite, how to be patient in listening to the patient's concern and treating them accordingly. And he also taught me that every case is a new case. Let it be a routine case. He made it to a point that I always come. She has given us the complaints of a very trivial fall which was not amounting to the fracture we had diagnosed in the x-rays. We have further evaluated it and we have confirmed it that the patient has diffuse Burkitt cell lymphoma. We have, with the help of a hemato-oncologist, we have treated the patient with the chemotherapy along with immobilization at the fracture site. We have not gone for surgical intervention, but we have managed it conservatively. And we had post-management 1 year follow-up of that lady, and she's doing excellent. One of the case report that we have done, and I have done an ankle fracture which was much appreciated at the state conference.
What do you think is your mentor and how that has helped shape your career?
Actually, the branch which I am is a male-dominated branch. So when I joined the branch and when I have progressed further, during the midterm of my tenure, I was very low in confidence and I thought maybe I could not do it because this is a male-dominated branch. But I had one person who kept motivating me, and I would like to give that credit to that man who has shaped me in a way that when I came out as a better person. And it's a challenging case for me, and the results were extremely good, and patient was very happy because we made her walk, and she went very happily from here. So I was very content that the patient was happy.
About one 8-year-old boy,
yeah.
pediatric
One more challenging case. In orthopedics, pediatric fractures are always very challenging. You need to know when to operate and when not to operate, because majority of the pediatric fractures you can operate it without surgeries, but there are few fractures where you have to do a surgical intervention. One such case we had in Olive 6 weeks back. Child was 9 years old. He had fall from 6th floor. By God's grace, nothing happened to the child. Yeah, he had quite a few broken bones, but his life, he was alive. That was his biggest blessings from Almighty. So he had both leg fractures, he had an arm fracture, he had a mandible fractures, he had lacerations, but we have taken an appropriate action, and from the time the patient got admitted, within a span of 24 hours we have fixed that fracture. And recently we have started mobilization of the patient, and the patient is doing good. So along with saving the limb of the patient, we have also saved the life of the patient. One important thing I want to tell, that working at Olive Sarvodaya, what advantage I felt was, because this hospital is a tertiary hospital, and the patient, my pediatric patient, was an 8-year child, so cross consultations was such an ease. So before taking the patient to theatre, I had taken a consultation from a vascular surgeon, from a neurosurgeon, and from the CT surgeon, because of the amount of injuries the patient had, and everything happened so easily that without any difficulty I could mobilize the patient to theatre and I could operate him. The surgery has been done 6 weeks ago, and patient is doing very nice, and his family is very much happy because they are not from here. Apparently they are from Bihar, and they could not enjoy the privileges normal below poverty line Hyderabadi or people from our state could take a benefit. So with a very low and affordable package, we have operated to that boy, and the boy is doing good.
Because before going to a surgeon, and in what way Olive will be helpful in such cases?
Olive Sarvodaya right now I think is the best affordable hospital you will find in this area, because they have all the insurances included. And I think right now in this 2025, apart from rich people, even the upper middle class and middle class are taking the benefits of insurance, because everybody is so much educated, they are considering insurance as an option for their healthcare system. Insurance in the healthcare system was not very much rampant 5 years ago, but now rapidly it is progressing and people are understanding the importance of insurance. So Olive Sarvodaya gives you that advantage of covering most of the insurances here, and the payment packages what they give here, it is very much affordable. I think middle class, upper middle class and a lower middle class, all the people can afford it at a very low and affordable,
even without the insurance also.
Even without the insurance. Population, older men plus 55, they come to me with the patient with the complaints of chronic low back aches. Most of the women, because in our scenario women are either moderately obese or obese postmenopausal, so they come to me with the complaints of chronic low back ache. They comes to me, a diabetic patient will come to me with the complaints of pain in the shoulder, which is known as frozen shoulder. They won't have free movements like they used to have before, and they come to me with the complaints of pain in the knees. So these are the three common problems where lot of the people will be suffering, but they will come only when it becomes unbearable. So the precautions what they need to take is, we have a common cultural practice of sitting on the floor, squatting, using Indian washrooms, taking stairs. So these all precautions, these are the things you need to cut it down at after certain age. Like everything age in your body, bones age too. So for this you need to avoid all these practices, and you need to do a lifestyle modification, a better alternative which will give you painless environment along with the medications. So I will recommend the population of 45 to 65 plus to follow these precautions and come and visit an orthopedic surgeon at the earliest when you have a slightest discomfort in activity of your daily living. Lot of common people, especially in the Indian scenarios, because we are very much hard working, we don't go and visit a doctor until it becomes very difficult for us to do our activity of daily living. For example, if a 65-year-old woman or a man comes to me with the pain in knees, I can tell you without seeing the X-ray that his knees had reached to that aging stage of stage 3 or stage 4. They never come to you when it is in a stage 1 or in a stage 2. When it is just in an initial stage, the discomfort will start in stage 1 and stage 2 itself. But we as an Indians, because the hardworking nature and the multiple factors what we have, we ignore that and we come here only when it is unbearable to us. So I request everyone, when you have a slightest discomfort in your activity of daily livings, please visit your nearest orthopedic surgeon and just take a proper advice and proper consultation and follow accordingly. Orthopedics is never about medicines. If you come to me with the pain in knees or low backache or frozen shoulder, medications cannot give you 100% pain-free environment. Along with the medications here in orthopedics only contributes for 30 to 40%. Rest, it is always physiotherapy, it is always diet modification, it is always lifestyle modification. So orthopedics is a multidisciplinary branch. It is not always about medications or always about surgery. It has lot of contributing factors such as physiotherapy, diet modifications, lifestyle modifications, and what all precautions you need to take. Service to mankind has been my dream and passion, and the reason for my association with Olive Sarvodaya Hospital.